like to pay a couple respects to the people that made me what I am today.
Laughing gear.
It's all my love. It's all my love.
The quiet man.
It's all my love. It's all my love.
Dopamine. Jim.
It's all my
Welcome to
love.
the Soul Patch Podcast, the podcast where three expats discuss education, culture, and life here on the Soul Patch of Asia, the Korean Peninsula. I'm Jack, and I'm here with Kevin and Ryan. Guys, how are you doing this evening?
What's up, guys? All right.
Doing good.
Awesome.
Stoked to be here.
I wanted to start today's podcast or tonight's podcast off with a little correction from last week. We talked about waste management in Korea. And as I listened to the podcast last week, I realized I got my decades mixed up a little bit.
What happens?
Yeah, I know that happens sometimes. You know, the 70s, the 90s, who knows? But I was talking about the economic boom that caused that was really the impetus for Korea to go to the pay as you throw away your garbage system. That economic boom happened in the 70s, from the 70s to the 90s. And so I said last week it was in the 90s and the 2000s. That's actually in the late 90s. There was an economic collapse, and that's the
Right. That was the IMF that we
we'll talk
really
about that.
briefly.
Exactly. And there is, I mean, if you look at Korea's economy, like the growth chart, it is basically like a 90-degree angle going upward with two dips. The big one in late 90s, and then obviously the 2008 financial crisis where to rip through every country. I apologize to listeners out there. And the other stat that I kind of messed up was at the time in 1970, Korea was producing 12,000 tons of garbage per day, not total. So that was per day. And then by 1990, they were producing 84,000 tons per day. So you can see that it was like eightfold increase per day. So they had to do something. And so that's why in the mid 90s, they switched over to that system. So
Nice. Well,
anyway,
thanks for the correction. I'm always a fan of getting the correct information. And so,
yeah, I don't want the listeners out to, start holding court out there and have the wrong information and then blame the Soul Patch for the bad info. So
I heard it on the internet.
Yeah, you're talking trash. Then you got the right info here.
Nice.
So we had a different topic planned for tonight, but I think the fact that are we technically entering the fourth wave now? Is that
Yeah, I saw an article actually just earlier saying that we're in the fourth wave. I mean, I don't know who's in charge. I don't know who's the surfer on the board judging the waves, but yeah, I would say it seems pretty safe that the fourth wave hath begun. I mean, we're at 2 days in a row. Oh, I've got the numbers for today. So yesterday was our almost record-breaking day. It was the second biggest day ever at, 1,212 yesterday. As of 6 o'clock today, we were already at 1,100.
Oh, really?
Already.
Okay.
So we'll get So we're already at 2 days in a row of over 1,000.
Mm-hmm.
We will see what the final numbers are tomorrow when it gets released. But as of 6 o'clock, we were already at actually slightly more than we were at 6 o'clock yesterday by like 4 people. So it's very similar to what we were at yesterday.
Yeah. So I think that means that we're definitely in a crisis point, I would say, as far as the number of infections.
Yeah.
Okay. I pulled up some data. Do you guys know when the third wave occurred? Are you guys did you follow?
Was that the one
close?
with the?
No, not really.
I mean,
okay.
I
looked it up
remember
really
because
quickly.
I've been reading the data about today, and people are talking about the last ones. Is the third wave? Is that when the last record was, or when the record day was?
I don't know. I think the record was from the December of 2000. That was early.
It was last.
Right.
The current record day, depending on how today goes, was December either 24th or 25th, like Christmas basically.
Right.
And that was the third wave?
That was the third wave, right? Because
right.
I looked up the third wave, they're talking about coming out of it in January. So they were implementing
that was
pretty strict social distancing measures in order to try to mitigate that the third wave. And the thing is, I don't know if you guys feel the same way, but it's all like happening on television for me. It's not none of my. It's not. I don't experience anything different. Maybe it's because I'm out in Gyeonggi, or because we're working from home. But I don't. It's just my experience is it all bleeds together. And I'm wondering if you guys have felt a difference when things tighten up in Seoul and when things had loosened up. Do you feel a difference?
I had a conversation about this morning with a friend, talking about how we react to things, how we internalize these events versus the real and immediate physical objective effect. So, like, for example, right now we're doing a whole podcast about how this is a crisis. I mean, I shouldn't say air quotes, it is a type of a crisis. But when it comes to and I'm not downplaying COVID at all, it's a serious issue. But let's just look at statistics for 1 second. Like, in Korea, if you're under the age of 50 years old, so everybody under the age of 50 years old, there are about 95,000 cases of COVID total. So that's a drop in the bucket compared to a lot of developed countries where there's like pretty good stats coming out, pretty good record keeping. We could assume. How many people do you think have died under the age of 50 in Korea? 100,000 cases. How many have died? Take a wild guess.
5, 10, 20?
It's 26, actually.
500?
26.
26.
26. Yeah, and if you're under the age
wow,
of
there's over 2,000 deaths total, right?
Yes, but what this you have to remember is, I mean, COVID is very much a disease, a virus affecting old people. So if you're under the age of 40, so that'd be Kevin, right? You're still not 40, right?
Correct.
Yeah,
I'm not up with you guys.
Under the age of 40, the total number of deaths in Korea is 11. And if you're an 18-year-old that's been going to high school, every day through this whole thing, regular Korean living here, not traveling internationally. If you're a teenage kid, 0. There's been 0 deaths under the age of 20. And the reason I mention this is not to downplay the virus, but I think it's interesting. It makes a good conversation about how we react to it. Because I think Korea's done a really good job at creating vigilance. Based on the statistics, I really should not be that worried individually about myself. It's completely unlikely. It's just not going to happen. You're not to get COVID is going to be really hard, and to die from it's nearly impossible. But I still take the threat very seriously. And when I put a mask on to go outside, or I'm going on my runs, whatever, I'm not just doing it to
performatively, Yeah,
it's not just for the audience. It's not just for grandma downstairs, the people in my neighborhood. I put it on because it makes me feel like I'm being safe to myself. And so I think Korea's done a really good job of getting everybody into that space. My friend was commenting about the same thing. So she was saying that it's the same for her. She's like, I know the math. I know, like, what was the example? If I laid out 10,000 jelly beans on the table and I said, one of them is going to kill you, but for every jelly bean that you eat, you will get 100 grand, 100,000 US dollars for every jelly bean you can eat, right? One of them's deadly. So how many of those jelly beans would you eat? Now, if you absolutely want to protect yourself, you'd walk away from the deal. Maybe you don't care about 100 grand. We could pick a different number, whatever is motivating for you.
Yeah.
But the rational thing to do would be to probably pop a couple jelly beans, because it's around the same likelihood of getting COVID is like getting in a bus accident at this point. Bus accidents do happen, but I don't feel that way about COVID. I don't feel it's like the jelly beans or the bus accident. I feel very vigilant about it. I'm very concerned about it. And it's not just, again, for other people. I feel it for myself. And even though I can talk about this in the math and statistics, the culture of awareness that Korea's managed to develop, I think is really good, and that gives me a lot of optimism for this this spike that happened. Literally, was it just yesterday is the first day of it, and this is the second day?
Yeah.
Right. Although we haven't been out of, I mean, it's been at high numbers for a while. We were at 700 for the past week as well. So that was pretty high.
Yeah, but if you look at the last week though, the last 10 days, it's trailing. It's trending down. So the highs are lower highs and the lows are lower lows for the last 10 days. We were headed down. And then just the last 2 days,
Yeah, but if you look just 20 days, then it was a big jump up because it was like 500, 500, 500, 700, and then maybe slightly less. But so we're still like 10 days was still higher than 20 days ago.
Well, this is kind of interesting.
I mean, it was a 10-day trend, not a 20-day trend.
80% of the new infections are from those in their 20s and 30s.
Right.
So this is a like clearly Hongdae, Gangnam situation, right? It's like it's just COVID fatigue is the way I see it. It's like young people were
oh sure,
this is bullshit. It's been a year and a half. You've kept me cooped up. I haven't been in the classroom in since 2019 or whatever. And I think people are just. I think it's a similar dynamic that I think in America is experiencing. But the thing that pisses me off about the American situation is that there are people that are not getting the vaccine by choice. You know what I mean? Like it's like it's right there. Like the three of us, I'm speaking for you guys, but please correct me if I'm out of line here. But I think if the three of us had the choice to go get the vaccine right now, we would all get it. Am I correct in saying that?
Sure.
Okay.
Yeah, I'm on the waiting list.
Yeah, I mean, like, and so it's kind of annoying that these vaccines are going bad in America, and we can't even get our hands on one right now. And
the people not taking it back there, I mean, it's pretty.
It's all for ideological purposes,
It's terrible. I saw some. I don't remember which state. It was Nebraska, maybe. I saw something that they said all of the recent COVID deaths, 100% of them were unvaccinated people. Mm-hmm. So yeah, people who aren't getting the vaccine are honestly, I kind of don't really feel bad for them at this point. They've made their own bed at this point. They've had the option to get the vaccine. I mean, plenty of time.
I mean, come on, they died. I mean, it's okay to feel bad for them.
Yeah, I mean, I know, I understand the impulse that you have, but I mean, at the end of the day, as like as a human, we of course don't wish death on anybody.
I don't. It's a frustrating. If I see someone jump off a bridge, and after they've been told, "Don't jump off that bridge," and they do, and they die. It's like, well, they kind of had it coming.
I see your point, but the reason I'm hesitant and I reserve judgment and all that is kind of based on what I was just talking about, how the collective really creates the opinion. I would think that if you took a handful of people here in Seoul, and let's say 80% of them are willing to get the vaccine, and you take that same population and you slap them in the United States for the last year, it would probably drop to like 50 or something. Like I think there's something about the culture around it that's informing that decision. That's
100%, 100%.
I don't, of course.
Like there's people that just don't have the information, or they're getting bad information. I mean, that's misinformation. That's a pretty big issue this, 21st century.
I want to jump back to what you said, Ryan, because I think the place where I get my news, which, and I consider myself I follow politics a little more closely than your average normie. Like I ingest a lot of political, but it's all new media, and it's all progressive, because that's my ideological core. I feel like I am a progressive, and so so I think that you're right that there is a tendency, I think, on the left to kind of get hysterical about it too. You know what I mean? Like because I think what you're describing is kind of is kind of I can't think of the word, but being hysterical about it, and maybe.
Not, but I wouldn't want to say to either go the other extreme and say it's not an issue, or to call the middle. I wouldn't try to call the middle on an issue like this. Mm-hmm. For me, this is an old idea now. For me, I would be very, very comfortable saying that I'm going to err on the side of hysterical, because what's the worst that could happen for me? Like, oh no, I was wrong and I wore a mask.
Right. It costs you,
know,
nothing.
like,
Yeah.
it's okay. It's okay.
Yeah.
Like, so I'm not even going to, like, I just don't like to even like touch picking a side there. It's like, no, if you want to ask me, I'm going to take all the precautions because I'm not an a-hole. Like, like
Right.
I want to, you know, like if everybody laughs at me later, like, COVID wasn't real. Look at you trying to be nice to people. Like,
Yeah.
okay, fine. Make fun of me for being a good guy. Good. I like that.
Yeah.
And that's the same with all of the government precautions that we're going through. If the government does a good job and clamps down things really hardcore, and then we don't get an outbreak, everyone's like, well, what did we do it for? And we,
Yeah.
but if we don't do it and then we have a hardcore outbreak, everyone is saying like, well, why haven't we gone hardcore on it? So yeah, I'm the same. Like, I'm saying right now, they need to put us into a higher level of. They've got a new system, by the way. I don't quite understand how it works. It's a 4-tier system now.
Yeah,
I know
I've
it's
got
been
them
like,
right here.
Oh, I heard
do you guys want to hear?
Yeah,
Okay.
please, because it
Yeah.
changes every damn week. It
Yeah.
feels
I got
like.
the I got them right here, and as you guys know, my wife and I are small business owners, so it's you have to stay abreast of this sort of stuff, because you don't
Sure.
know if you don't want to be held responsible for if somebody does get sick or be but it's really hard to kind of control people too, you know what I mean? Like, they're going to do what they want to do. And so level one is maintain at least 1 meter distance from others. And so yeah, at least 1 meter distance. So I mean, that's, I mean, I see people hugging on the when I was driving home tonight. I see people holding hands and walking. There's nobody's following this, when it's
I wonder.
like level
So
one.
that's 1 meter. That's all that level 1 is? Just don't be hanging over the people on the street next to you.
Exactly. It's just like,
basically,
you could have as many people together as you want, but as long as everybody's a meter apart. So
that seems
it's a very strange,
yeah, we'll do virtually nothing. I mean, it is level 1, so that basically means that we have virtually nothing to worry about if we are at that stage. So
right.
Okay,
and
so that's
I
think,
noticed on yeah.
Oh, sorry. Go ahead.
Sorry. I've noticed on Namsan, on the trail, it's like, it's like a 2-car lane wide trail just for walking. And when I'm up there running, obviously when you're running towards people, they give you, everybody gives each other a little space. Someone's coming up on me, I give them a little space. But since COVID, it's definitely more than double, like the human, what do you call that? Your comfort zone, your physical comfort zone.
Personal space.
Like that, your personal space. Yeah, your personal space on the trail it's more than doubled. And it hasn't changed since this all began. It's like everybody has a force field around them when they're coming by each other.
A couple
nice,
of it's well, the thing is, when I went jogging in my neighborhood, I run sporadically. I have a hard time keeping up with it, but there's a lot of people like walking, and so there's not a lot of space to give that. There's no way you could do a meter of social distancing.
Oh, like on a sidewalk.
Yeah, on the sidewalk. So I run with a mask like fully over my face. I just kept the mask on the whole time because there's a lot of elderly people that are walking around, and it's not that I'm afraid. I'm just want them to know, like you said, I'm not an a-hole. It's like I care about you. Like I would feel sick if I would contributed to your bad health in any way.
And the camaraderie around that thing, it's totally real. I mean, it's not just in our heads. I passed a runner just a few days ago, and okay, so the trail I run is that double wide, but that's just like the first half. Of the other half is on a sidewalk as I come back around through the other half of Namsan. It's like the base of Namsan. And so I'm up on the sidewalk. So when I get there, I always pull my mask up. If I'm in the mountain and no one is around, I'm running at midnight typically. So I'll take the mask down, but I always have it and I pop it back up. I passed a dude coming at me and we both did the same thing.
It
was like, and it was like at the same time, we both did one of these. Like,
you got
right.
For our listeners out there, Ryan's giving the double thumbs up. Our
podcast.
Right.
Yeah, it was kind of cool. Like we both gave each other a thumbs up. Like, right on, dude.
Yeah.
and we're two guys that are probably, he's probably between like 20 and 40 years old, and it's not like we're really, again, mathematically are really worried about each other. We're two like health nuts up on the mountain at midnight. This isn't like a real threat, but you do it
Right.
because it feels good. And that's a good thing, that we feel good about being healthy for others. It's deep. It's just like automatic reaction.
It's in the DNA here. I mean, this is going to be a kind of a aside, but talking about the IMF crisis and how Korea pulled itself out of that thing is going to make a great podcast. I have to do some research about that because I don't know enough yet, but I know that what they did, the community as a country pulling itself together and pulling itself out of that financial crisis was nothing short of a miracle. And when we talk about it, you just can't even imagine it happening in the States. It's just so I guess participating in that kind of vibe or whatever, it does feel good. And I wish I could just I want to try to, for our listeners that are in the United States, I would love to be able to just like translate this to them and just try, just participate in the, in the what you're talking about, that vibe of doing good to your brother, just the golden rule or whatever, you know what I mean? And it's just it's kind of frustrating to kind of watch it from overseas and see, that there's just like for example, a story where there were a couple of kids sitting on a bench, and they were a couple of I'm gonna assume they're right wingers or whatever, started accosting them and yelling at them for wearing a mask. Why are you wearing that? Take that thing off. It don't you know? And it's just like, what is the point of that? I don't understand what that serves. It's so, I don't know, self-indulgent or whatever. And so I just,
to be fair, not everyone in Korea is quite as altruistic as they make it seem. I have seen some stories in the news of similar things to that, of people like yelling at people for wearing masks or things like that. I mean, it's very rare. That's like the one dude, and it happens like once a month.
But are they given a platform? I mean, that's the difference. Like if someone does that and they're like, hey, take off the mask. In Korea, I think typically the reaction is, yeah, that's the crazy guy. Shut up.
Oh, sure.
But in the States, it's a politicized thing. And we give them a platform. We're like, maybe they have a point. Let's hear their opinion.
Right. And then it's somewhere in the middle. So wear the mask half off your face and half on. And then that's the right answer, like.
Right. Yeah. So let's have half measures. Make everybody happy.
Everybody's a moderate,
Not on this issue. Any other issue we can do, but not this one. Come on. Let's just make this simple. It's not an inconvenience. It's not that big of a deal.
I know.
But
it's a little piece.
So let's see. What's step two?
Okay, so number 2. Yeah. Thank you for pulling me back to back to earth here. Number 2 is they ban private gatherings of more than 8 people and require people to keep 8 square meters apart at coffee shops, restaurants, and other places of public accommodation. So that's level 2.
What does it mean to keep 8 square meters apart?
So
like you're center of an 8 square. You're the center of it.
But I mean, if I'm saying keep apart from someone, wouldn't it just be better to say stay 8 meters away instead of stay 4 meters away?
I think what
is my 4 meters moving?
No, I think what it means is I think it's a mathematical formula. So let's say your restaurant is like 40 square meters or whatever. That means you can have enough people that'll fit 8. You divide it or whatever, and there's some kind of it's like the threshold is 5 people or something. Yeah.
Okay, so it's not an individual. You stay X number of meters away from everyone around you. You have to be constantly calculating how
you have to wear like a hula hoop thing. It's kind of it's got suspenders on it, and then
but if one person gets closer, then other people have to get further away to balance. No, that's okay. So it makes more sense. Yeah, in a restaurant or in some type of establishment, they do the math and X number of people per square meters. Okay.
I think it's just a shorthand for like cops who are do I write a ticket or not, and it's just okay. How many counting is this or whatever? Yeah. Number 3 though is it's where shit gets real here.
And is this where we are now? I assume we're in.
We are 3? At level 2 right now, at least in Seoul. Now it's level 2.
And it sounds like we're going to jump to 4, right? That's the idea. No, but we're going to jump over 3.
Right now, they're still limiting to people to parties of less than 5. I know.
Yeah, you know what? The thing is, the weird thing I found is I think less than 5 is 1.5. I think they started making like in between.
Well, that's where the whole system is just ass backwards, because we've had like so many different systems as well. Like this new 4-step system is pretty new to me.
Mhm.
The last I remember, there was a 2.5 step system, and we were at level 2 of 2.5. I remember a while ago, so it was like effectively 4 out of 5. I don't know why they were doing half
Well,
steps,
that's
but
when,
then
yeah. Sorry, go ahead.
yeah, then there was also like step 2.1, and they were
Yeah.
like turn one thing on the gauge up, put other things down, and it was just wiggy. And so I think they're still mixing things up a little bit. So we're officially at level 2 of 4, which is interesting, but it's not like just following those guidelines.
But it's level 2 for Greater Seoul, and I'm
Okay.
assuming Gyeonggi as well. But it's
Probably.
level 1 for all other areas in Korea. So if you look at the map, it's like Seoul is quite on fire. Well, I hate to use that kind of inflammatory language, because like Ryan was kind of laid out, statistically this thing is still under control, but the most of the new infections are in Seoul and Gyeonggi and
Yeah.
Gangwon-do. But as you go, as you get farther out, it's not a problem. So I think everywhere else is like level 1, but Seoul is at level 2. But it looks like we're heading to level 3, which is to ban private gatherings of more than 4 people and advise people to stay home. So
Yeah.
that's when.
What I heard in the news today is that they're going to jump level 3. We're going to go straight to level 4.
Oh, okay.
That was the buzz this morning.
Okay, what I
That it
saw
might not even
recently, I mean, we're all getting our news from slightly different sources. I saw that they were,
Yeah.
the last I saw was that we're still at whatever level we're at, level 2.3, and that they're going to wait like 2 or 3 days to see what happens and then make a decision, which to me seems a bit late. Like 2 or 3 days isn't really going to do much of everything. I also saw in the news that they're anticipating that it could jump up to 2,000 a day within the next week or so. So yeah, I mean, jumping up to level 4 is, I'm not a government, like,
Well,
think head on this,
there's some
happen.
serious economic implications for 4, because
Right,
private gatherings
they've
of
been
more than
avoiding
2
it.
people banned. So you can't have more than 2 people. And after 6 o'clock, merchants are required to close shop by,
That's the big one. That's
by
the big
9
one.
p.m. Sorry for 9 p.m.
Yeah.
And that's the
That's
one
the
that
big
just
one.
that just destroys. It's what already destroyed everybody the first time around, and they're just starting
Right.
to kind of come out of it. And all of a sudden, this 4th wave has really got people spooked, I think. And it's mostly about the merchants,
And that's exactly why we were talking about it this morning, was
Mhm.
because it's the actual one that, it's the detail that's going to have the biggest economic impact. It's that's a huge decision.
Yeah. I
And
think
that's where-
that's why.
We'll see what happens.
Yeah.
That's where Korea just did things so differently. I mean, if we go back a year ago, or even slightly more than a year ago, when Korea was like number 1, when everyone in the news was talking about how badass Korea was at handling this, that's where Korea did really well, is because they managed to clamp things down while keeping the economy open. You have other examples of countries that also did really, really well at controlling COVID. Vietnam, China, of course, like they clamped shit down, but they also closed their economy, and just shit tanked. And so that's where Korea, and that's where it's a very tight balance. It's like, for me, who's not a shop owner, I'm like, clamp it down, let's just get this shit done. But then of course it's like, but then, I mean, there's a lot of people's lives who are affected, not from getting corona, but from business and from their work and things like that. I mean, so it's a tightrope.
I mean, the thing about like China is that's, I mean, they can like a scalpel, they shut down Wuhan, right? Like they can do it immediately by just, edict, like this is done. This is the line. Don't cross it. And you just can't do that it just doesn't work in a democracy, or
No, of course.
And so the second best option is what Korea did, was like, let's just test like crazy, and try to let's find these clusters and shut it down and get these people quarantined. I think the problem now is that it seems to be very spread out. Like I said,
Right,
among these 20s and 30-year-olds, and that's I think the problem might be that it's just like a matter of how do you get young people to comply. And my sympathy really does, like, I really do sympathize with my students, because our students are they're in their 20s and they've put up with this for a year and a half, and they still like last on the list to get the vaccination. But like Ryan said, there are no deaths. Did you say no deaths of under?
Nobody under 20.
18.
Zero under
Right.
20. Zero under 20. I was using 18-year-olds as an example, but zero under 20.
Yeah, 0 under 20.
Yeah, I mean, this is like you were saying. I feel really bad for young people today, and I'm really glad that I'm not a young person today. Like my idea of a good Saturday night, even before all this went down, was generally chilling at home, drinking a bottle of wine, and watching a movie with the wife. Like that is, I like that. That's fun. 10 years ago, or when I first came to Korea, no, that's a terrible Saturday. And I would be one of those crazy asshole kids being like, I'm just gonna go, it'll be fine. Like I'd be one of those people out there. So I'm glad that this, I'm glad I didn't have to deal with this when I was that age, I guess.
Yeah, because I did not have the maturity to deal with that either when I was in my early 20s or my mid 20s. Well,
I would have failed
late
this
20s.
test.
I mean, that mask would have been like an eye patch after a couple of drinks, like this is hilarious, right? Or whatever.
I think a lot of people, again, trying to give some credit to even the younger people, like Kev said, a year and a half for someone who's, I'm always thinking of the students that we have that started as freshmen in the beginning of this. They haven't had any university. Could you imagine the first half? I mean, that time is so much longer than it is like for us now. Like it's so substantial. Your first 2 years of university just basically don't exist. The university experience. I think a lot of those students, I do think they probably are breaking some rules, but I imagine I'm trying to think what I would do. Like what Kevin was saying, like, I'd probably be the guy going out. I think me and my friends, we would just make our own rules. We would still have rules. We'd still want to do the right thing. Like we would have parties, but we would all wear like surgical gloves and, it'd be like a, like a surgery party,
Yeah, right.
You have to drink through a straw through
a shield.
Exactly. A straw through the mask, like this kind of thing. It would be, we're all going to do like, bubble party. Yeah. We're all going to wear like flaming lips, we're all going to be inside bubbles.
Right.
Like something like this. I think people are still, my point I'm trying to make since the beginning of this discussion is that I think the sentiment is still very proactive here. Even if you do have fatigue setting in, I still don't think you have people flipping the table being like, this is a lie. It's not real. I'm quitting. I think it's just like, damn it. Can't we just go out and have a beer? I will sit way over here. You sit way over there. He sits way over there. I think it's like this kind of attitude, like people trying to like, well, just make it work. We're just going to make it work.
Throw me a bone, like give me something that I can, like you can't just expect me to, that's really interesting. I had a thought there and it just escaped me, but
it probably is like Ryan was a lot of young people. So I mean, it's easy to assume that they don't know what they're doing, but really, I mean, they're probably doing the same math that Ryan is doing as well. They're, like, okay, 1,000 people got it yesterday out of a city of 10 million. Like, we can go and hang out tonight. We're going to be okay. And they're thinking that they're going to be okay because it's just been so goddamn long. And they're like, one night out isn't going to hurt anyone.
But that's not my point. So, I'm not saying that I think that at all. I don't think that at all. I don't think it's okay. My point is opposite. I'm saying I react to it as though it's imminent.
I'm saying that's what the young people today are doing, is that they're just, they're saying like, okay, it's been a year and a half.
Statistically, I can read that it's not that, like I'm looking at the stats right now on Corona Board. The 70 and 80-year-olds make up 80% of deaths. 70 or older is 80% of deaths. They make up 10% of infections. So, you just look at these numbers and it's like, yeah, even if, and it's very unlikely that you would catch it, but even if you did, we'll be
You're
fine.
probably going to clear it. Yeah.
And yeah, you're going to clear it unless you have some underlying health issue.
The
That's
problem is
like
though, how many of the young people, like our students, live with their grandparents? That's the other thing. Is that
exactly.
that's the thing that I think
Yeah.
scares the pants off of them. Is like they're like, I don't want to kill grandma. I don't want to kill grandpa.
Oh,
and that keeps them in line here.
The owner of this house that we live in, she lives alone on the first floor. She's, I think, 86.
Mm-hmm.
And like I don't even approach, like when she wants to talk, she stays on her porch by her door. I back up. As soon as she comes out, I back up and I'm like, hey,
yeah,
Onion, what's going on? I'm over here. You're over there. Yeah. You don't want to, yeah. Yeah. So I think that I still think there's the vigilance here is real, but the fatigue is definitely starting to set in. I wonder if that's what it is, or per the conversation I was having this morning, I don't want to go completely paranoid. We don't know yet, but this Delta variant
right.
being resistant or something to vaccines, if that's what's going on, because we had such a handle on this, it seemed like it was trending down, and then it pops just as this is coming online.
Let me ask you something.
There is
Ryan.
a lot of Delta, and I don't think that from some of the things that I was reading about some of the articles today is just saying that like the Korean quarantine from abroad has been a bit lax. And so apparently like Delta's definitely here. So we're dealing with that. I don't know if that's what is spreading right now or not, but it's here. We're definitely dealing with it.
My understanding is, and Ryan, I think you could probably talk about this with your background in biology, but my understanding was that the virus mutated, and it's almost like a lock and a key. And that it rotated, and so now when the virus is in the air, it's like it just fits together so much easier, so much more smoothly, and so it's a lot more contagious, the Delta variant. And but if you're vaccinated, apparently you still have some protection. You might get sick, but you're not going to get as sick as you would if you didn't have the vaccine. And so that's why they're still really pushing the vaccine in the United States, saying, they've got all these vaccines that are just basically going bad, and millions of people that won't take it. And if this Delta variant just sweeps through, it could be it could be catastrophic in the United States. But I feel like I don't have that feeling of dread when in Korea. I feel like they're going to be able to figure it out, and it just because I think it just comes down to, like you said, the culture, the political ideology, and is so poisonous in the States that it's actually affecting how people take care of their own health. I mean, it's the strangest time in my life right now. I wonder if you guys feel that way too. I mean, this is it's a once in a lifetime event, I guess, a global pandemic.
Hopefully.
But I mean, just the politics and the pandemic, along with the politics on top of it, it's just surreal, and it's such a strange time to be alive. I don't know. I'm not sure where I'm going with that point, but yeah.
I mean, everything gets politicized. Things get politicized here too. It's just, America's like a professional at it. It's and you could politicize like cheeseburgers. I mean, they are, right.
Well, freedom fries, don't not French fries, right?
Yeah, and you thought that would have been the end of it, right? Like that was ridiculous.
I thought we jumped the shark at freedom fries, Yeah.
Yeah, that was just the beginning.
No.
Yeah, but you take an issue like this where you have an authority telling you what you should be doing, and it's very easy for someone to create an opposition to that and make a tribe, and that's just how I see it. Yeah. And again, I mean, I don't even think about the politics when it comes to this, what's been going on this last year and a half. I mean, I read about it, whatever, but I don't speak out about it. For me, it's just a personal decision. Like I said before, I'd rather err on the side of being laughed at for taking precautions because I was trying to be considerate to other people. Like that, okay, if that's the worst thing that's going to happen, laugh at me because I wore a mask.
Well,
it's not even, you wouldn't be laughed at for wearing a mask. Here you'd be shunned for not wearing a mask. So it's like you were saying, if you took those,
like after, let's say after like the virus turns out to be fake, right? the population, like let's say all of Korea, like the whole culture changes its tune, and like 90% of
Turns into Fox News or whatever. Like,
yeah, like that's what I'm trying to say. Like it's like it turns into Hannity and Friends or whatever they call it. And
good,
you know, it's
good
just like
God, yeah.
Yeah, and they just all descend, and I'm like the one guy that like they're like, oh, he wore a mask, ha ha ha.
What a
But
cuck,
yeah.
yeah.
I was trying to like be nice to people. I guess I'm an idiot. Ha, you got me. You know, I'm over it. But on the other hand, I mean, what's the benefit on the other hand? I might not look like an idiot, but I might also be responsible for promoting, just further distributing this virus and harming people.
Exactly.
So it's a no-brainer.
Did you?
But it's so funny how much politics you can pump into it.
Did you ever wear a mask before the pandemic? I mean, I always had, like, since living in Asia, since I've been living in Asia, if I had a cold or something, I'll wear a mask. In public, and it's such a, I would never, wouldn't even know where to really get a surgical mask in the States. You know what I mean? Like, you couldn't go to the local store and just buy surgical masks. It's not something.
And that's something, I don't know if we had talked about that before, but I think that's a really important point to remember too, is that the whole subject of like wearing a mask, despite, all these other things, social distancing, blah, blah, blah. But the mask thing, that's radical for Americans. It's radical because we don't have a day where you're walking around Chicago and everybody's wearing a mask, or like half people wearing masks. That's just never really happened, like since like what, Spanish flu or something. It's just not a thing. Right. But here we might have, the Huangsa, we have like the dust storms, or, the general pollution, like the Mise Munji, whatever. Or people, I have students, if they have a cold, they put on a mask. And I would do the same thing. So yeah, walking around and seeing like an uptick in people wearing masks here is like, that's a thing, not a big deal. But in America, like 10% of people wearing masks is like, whoa, what is this? The end of the world?
Exactly. And that the thing is,
we did already have a bit of a head start in terms of that kind of control here. It was wear a mask. Everyone's already got some at home.
Well, is it like a vanity thing, you think, for Americans, or is it just like we're not used to it? It's because there are things I've observed in Korea and Asia in general that I find kind of interesting. Like, for example, it's going to be kind of a crass example, but students in the classroom will stand up in class and ask the person next to them, "Oh, do you have any tissue? I have to go to the bathroom," and then the person will open their purse, take out the tissue, hand it to them. That would never happen in American classroom, where everybody just sees it, but nobody bats an eye here. Like, the students are just like, it's a biological function. It's totally normal. There's nothing to see here. But in America, it would just be the most it'd be the humiliating story that you take with you for 20 years. Like that time in college, or I don't know what it is about. Is it a vanity thing for us, or I don't.
I think Korea also just has so much of that. I mean, this isn't just Korea, but I really can't speak to it in other countries, so I don't know. But Korea just has that we culture here, right? I mean, that's what Ryan just said. Students will come into class just with a cold, in years past when nothing was crazy, and they'd be wearing a mask just so they've got a cold. And I'd ask them, I'd be like, "Oh, are you sick?" I'd be like, "Yeah, sorry, I've got the mask on." Like, "No, that's fine." And they're not worried about themselves; they're worried about other people. In America, wearing a mask, at first it was more about wear this to protect yourself, not to protect other people. And so Koreans, in this case, seem to be thinking about others more than Americans are thinking about themselves at this point. It's wear a mask to protect you from this. That was the advertising campaigns in the States at first, whereas in Korea, it's just wear a mask to protect everybody, including yourself. And now it is in America as well. It's wear a mask to protect grandma and grandpa as well, and that's a big part of it. But I think at the beginning, it was really like it's an us versus me thing. In America, it's very me.
That's really funny, because the media that I was consuming at the time was very much my mask protects you, your mask protects me, and it was very much a symbiotic kind of thing. Is that was the that's what they were preaching at the time, and a lot of the media that I consumed was you're not wearing a mask just to protect yourself. You're wearing the mask to protect other people. And but I think that is music to a progressive's ears, right? And so you have to sell it in a different way depending on where you're politically or ideologically, where your compass is set, right? And so, I mean, this is another aside here, but I want to know your opinion about this. Something that annoys me about the current political situation in America is, like, at the beginning of the pandemic, Dr. Fauci lied to the American people. We know he lied. He said, you don't need to wear a mask. Don't buy a mask. And they lied because there was not, because this goes back, and this is another problem with America, is we don't make anything in America anymore. We depend on, everything is imported, right? So this is a whole rabbit hole that we don't need to go down. But so I hear this still, like, okay, so Dr. Fauci lied a year and a half ago. So he doesn't know anything. I don't understand that mentality,
the wholesale dismissal.
Yeah, it's like, so he's just done. Like, all his 40, 50, 60 years of service and experience is out the window because he lied a year and a half ago based on, I think it was a terrible call. I mean, it was politically stupid and just dumb to do. But I still think he's a brilliant guy. And I still listen to the CDC. It's so.
Yeah, but I mean, the people who are saying don't believe him because he lied once are probably the people who are listening to a pathological liar about other things. So they're not making.
It's political warfare. It's character assassination.
Yeah.
So you take this one thing and it's the same thing. It was an article I was reading today. Elizabeth Warren, love her or hate her, whatever. Not going to talk about that.
Mm-hmm.
But the assassination on her was just absurd. About the whole, like, Trump called her Pocahontas and all this stuff, and she claimed Native American ancestry. Oh my goodness! Like, is that a reason to dismiss this person completely? Her whole political career, her whole background, and it happened. It was like, yeah, she can't be president. No. It was like, that was what? Like, and that's just how it works now. It's crazy. Yeah, so like Fauci, yeah, I agree. Like, that was a really poor decision. But can we just take a look at, like, the whole track record?
Yeah,
like, look at all the transcripts instead of just like the one assignment.
The bad
like,
call.
Maybe
Yeah,
there's something. Even I'm not even saying he's a good guy. I'm not even going to go that far. I'm just going to say maybe you should consider some of their achievements other than this one thing. Which, yeah, maybe it's monumental, but I don't know. That's just the way it works.
the Elizabeth Warren one is funny to me because she went and did that, like, 23andMe test or whatever to prove,
God,
and it's just like, I heard the best line I ever heard from this was Elizabeth Warren. She's such a nerd that it's such a nerd response. It's like, you're stupid. No, I'm not. I have a note from my doctor that says I'm smart. Look at this note. And it's just like, it's so true. Like, she just played right into Trump's hands, and it's just like, the political instincts there are so terrible. But I hate that it's all about that. It's not it's a cult of personality, and it's not about her policies, which is what really affect people. And it's why this whole rage against Fauci is so annoying, because it's actually affecting the policy that they're trying to implement. And people are just saying, no, you lied to me a year and a half ago. You're a hack. You're a loser. I'm going to listen to Dr. Drew or whatever, some other, madcap doctor or whatever. And it's craziness. Yeah. It really,
let's pull it back to Korea here.
I'm sorry. Okay.
How do you guys think about the fact that Korea was, like, number one at the beginning, and America was, like, number however many countries there are in the world, that number, and now it's, like, kind of not flipped exactly. I mean, we still have fewer cases than are happening there, but it feels like America has things under control now, and it feels, compared to our numbers, that Korea doesn't have anything under control. Like, and I don't like to use the actual numbers, because American audience listening and saying, like, they've got 1,000 a day, they're just like, that's nothing.
And that's a blip.
But you got to remember, I remember last summer when we had 9 a day, and it was just crazy. So 1,000 a day for us is a lot. and our numbers are going up, and the U.S. numbers are generally still on a downward trend. I believe I haven't been checking the numbers as obsessively as I was a while back.
We're just for reference, as of today, we're 86th in the world for total number of infections, and the incidence rate. No, it's mortality. Let me look for incidence.
But is that total
mortality
cases?
rate is very low. It's of total cases.
You can. I would
When you
like
say
to
we,
see
are
a
you talking
better.
about
50 million.
Korea? You're saying Korea?
Yeah, Korea.
Okay.
Yeah, I don't really care. Like total cases, I don't think is really useful because that's. I mean, right now I want to
Right.
compare, the last
That's why I was
month
about
or
to
something.
say the incidence rate here is
Nice.
29th.
Where's the U.S. now?
20. I'm imagining it's still right on the top. No.
Just curious. I haven't looked at the numbers in a while.
Well, I think
Why can't I find
this
it?
definitely comes
Scanning
down
red
to
flags.
the vaccine, right? I mean, that's
Oh,
America's
exactly,
vaccination program.
For sure.
And I have some stats for you guys here about Korea's current vaccination stats here. And 15.4 million people have been vaccinated with the first shot. So that's 30% of the country in Korea have been vaccinated. So I'm assuming that they're all people 65 or older, or people that had underlying health issues. Like that must be the first tranche of
or doctors.
Right,
Something
or
like that, of course,
medical
but-
professionals. Yeah.
Actually, my mother-in-law just got her second shot today.
Fantastic.
But yeah, she's in one of the earlier groups though, because she works like with older folks, like as a part-time job. So she's like in the age group and in the part-time job group as well. So
well,
she's
in the
10%
right now, because 10.6% of the country, 5.4 million people are fully vaccinated right now. So it kind of leads me to the. Sorry, Ryan, you were looking something up. Did you want to? Share that?
I need to make a correction. The incidence rates that I was looking at, when they sort from the lowest number to the highest number. So obviously, like a lower number means like a higher incident rate. So the U.S. for incident rate is 11th nation in the world, and Korea is like 112th nation in the world for incident rate.
So we're still
Japan's more than 112, 122. There's a
But where's
121
Japan?
nations that have a higher incident, 110.
Oh well, considering the Olympics are coming, that's not as still not good. Okay, so I mean, we're
other big
still
countries
beating America, though I don't like saying that. Like that's weird, but we're still doing considerably better than there. But yeah, just because that's so that goes back to my question. Like, I mean, knowing the numbers now affects how I think about it. But how do you guys feel about reading America? Reading that you can walk into the gas station today and get your shot. Like in the States, pretty much. And here we're behind on shots. Our numbers are going crazy. We're probably going to be breaking records in the next couple of days. Like it feels that we're on like a crazy downturn, even if we're still not doing as poorly, but pure numbers wise as America is.
But is it?
And it feels like America is just taking care of it.
What's that due to though? Because if you look at the number of vaccines that have been administered in Korea, I haven't compared the rate of the uptake of the vaccine, of the inoculations, what do you call it? I haven't compared the rates of US and Korea, but I think Korea is way faster. We went from like really no vaccines administered. We're at like 20 million now, and it's a population of 52 million. So we're past a third shots given. I don't know if that's completed vaccinations.
No, that's the first shot.
No, that's not.
Is about
the first shot.
Yeah.
But still, it's that's a pretty good. Where am I at?
The U.S. was doing pretty amazing in terms of their. Like the U.S. was killing it for that's a bad word. Sorry.
I mean, we had some days. We had some days there was 100,000 vaccines were given for the size of the population here. That's pretty substantial, I think.
100,000.
Yeah,
I mean, the U.S. Okay, but the U.S. had a couple of days of 2 million, I believe. And that's yeah. They really like when the U.S. when they cranked up their vaccine. There was a couple of days. I know there were a bunch of days of over 1 million, and I believe they hit. We should look this up, but yeah, there were pretty high numbers. And so, I mean,
well,
the U.S. has like 7 times the population.
He had a like a July 4th goal, right? It was like 70% of the
Oh yeah.
country, and I think they hit
Oh, I mean, he
67.
needed to
But
get the country opened
we're stuck
as
now.
quickly as possible.
I think we're stuck with this kind of recalcitrant group of people that are just
Yeah.
not going to.
Yeah.
You know, they're not going to participate in it, and so I know we
Yeah,
keep
it went up really quick.
spiraling back to the same point again. But I think you bring up a really excellent point. Ryan, you said you're on a list to get the vaccine. What how did that work? Like I'm not on a list right now. So how did you do that?
My girlfriend signed me up. It was on I think it was via Kakao. I can look at it right now.
Kakao does. I think they have the
Yeah,
waiting
I'm
list
pretty sure it's
sign up
Kakao.
things.
Yeah, it's Kakao. Actually, should admit this. I got a phone call for it, but I'm doing like a nocturnal schedule right now for my runs. So I was asleep when I got the call, and I missed it. And I could have gotten the shot, and it was like instant. I signed up for it. I think it was like 48 hours. I got the call. But yeah, I missed it, and I don't know if that kicks me down the list or whatever. But they it hasn't been since then. That was over almost 2 weeks ago, maybe.
Because now my wife mentioned that she's the teachers, at least in Gyeonggi. I don't. Maybe it's different between Seoul and Gyeonggi as far as how they roll it out, or maybe it's all like by city. I'm not sure how they're distributing the vaccines or whatever. But she said that
Honestly, I don't know either.
Teachers are scheduled for late July, and I'm trying to figure out if we're part of that that tranche.
No. As far as I know, that's only public school teachers. It definitely does not include Hagwon teachers. I'm pretty sure it doesn't include university teachers. I'm like 90% sure it doesn't include uni. Unfortunately, that's just, I think, public school teachers is what they're mostly worried about, because that's like, it's public things, whereas the university is mostly private, stuff like that. So they're worried about just getting those kids in the classroom, getting the kids. I mean, because that's another population that has been affected other than business owners are parents, having to deal with their kids being partially home or home some days or whatever.
I don't know how like two working parents managed this over the last year and a half. I just don't know how they were able to manage it. It's if I hadn't been home, well, I guess it doesn't matter because my kid's older, so but I'm trying to think of if like I had a young an elementary aged child. Man, it would be.
I think that goes back to something right from the very beginning, Jack, that you were talking about as well, is how we have like kind of dealt with this and what it's been like for us. Like you kind of started with that, and I think all three of us to some extent, and I know I've mentioned this to Ryan in the past and with other people as well, we're all affected. Certainly our lives have changed over the course of the past year and a half due to this, but all things considered, it hasn't been a crazy negative downturn in our lives. We've been able to handle it. You've been able to be at home with your daughter. We've been able to work from home. My wife is out of work because of it, but because we've been at home, that hasn't really been that huge of an issue. I'd say that's the biggest like negative thing in my case. But there's so many people that you know or know of who are business owners of a PC bang or a Norebang who are just getting boned, or parents who have to deal with their kids. There's so many people that are getting it much worse off than we do, and so it really does feel like this liminal space of this past year and a half that kind of all blends together for me. Like today, yesterday, and last February are all kind of the same.
Oh yeah, I'm trying to like make the most of it. Like when COVID started, I don't want to go too much exposure here, but you could talk to my girlfriend about this. I got pretty depressed. I really went down. I didn't see it happening. Yeah, it hit me hardest when it came to the break periods, because in our schedule, and again, for listeners that are tuning in because they want to know about our lifestyles as also teachers and working here, we have 4 months of holiday. a year. And I use that 4 months. That 4 months is a big part of my, not just like, go sit on a beach and drink a cocktail. It's a big part of my existence for the last 12 years is taking that time and using it to do things.
Mm-hmm.
Like, I rode my bike through Spain, and like I've done a lot of the different adventures. And I know Kevin has done many things like this as well. And having that taken away, it's removing a big part of your lifestyle. Now, most people don't want to hear someone bitching about,
Right.
oh, you lost your 4 months of vacation, a-hole. Like, I was on the phone with my dad. It was my birthday just last week. So I was on the phone with my dad. And I was trying to explain this to him, like, no one wants to hear it because like, my situation is easily among all of my family and like 90% of my friends, I have the best situation.
Right.
But it still sucks unto myself. It's still
that's the thing. You can't. I don't think that our brains work that way. You know what I mean? I think you had this thing that was your raison d'etre. Like I want to see the world, and all of a sudden you just lost this piece of your life that is so important to you. I don't think that the brain necessarily can manage all the feelings of everybody. It's just, you're just kind of like, this is how I feel right now. I went a different way. I started losing the war on carbohydrates, I guess you would say. I tried to eat my way out of the pandemic, but
how'd that work?
Yeah, it was terrible. It's bad for your cholesterol.
We kept eating, and we're still here.
My weight went up. I think I gained like 15 kilograms, and I lost like 10 kilograms, and I gained 5, and I lost 10.
For real?
So I just went way up and way down. So it's so weird how it affects you. Kevin, what's your Ryan was felt down. I tried to eat my way out of the pandemic. What was your coping mechanism?
As you two know, we've been dealing with an old dog for the past year. Our pup is kind of ill, and she's been our coping mechanism. So honestly, even if Corona wasn't a thing, I wouldn't really be going out much anyway because I have to take care of her. Mm-hmm. So, but I mean, we've also dedicated everything into dealing with her and making sure that she gets her 1 hour walks in every day. And so dealing with our dog has probably kept us as sane as anything. Actually, that's an interesting thing in Korea as well. I don't know if it's only Korea, but I have definitely seen it here. People are adopting more and more pets over the past year because they aren't able to fill that social need by going out. And so animals are becoming more and more and more. I mean, the number of people who are adopting animals in the past many years has been increasing. But in the past year, I've seen some articles about how that's just gone way up, actually. People are adopting more and more animals to be at home, to be their companion since they can't go out.
God, I hope there's not like a influx of street dogs when we come out of this thing. It's like I had my furry friend, my COVID buddy, but I don't need you anymore. So yeah.
No, hopefully not.
Swings the other way.
Never give a puppy as a gift for a Christmas present.
Right.
Yeah, we should also just kind of going long here on this, but I think it's worth tying into this discussion. We're talking about the negative side of what COVID life was like here, but I'd like to also just throw out what we've done for coping, because it's a unique place to be kind of trapped in this situation. I have some friends that at the early days of COVID, they just jumped ship. They went straight to the United States. Maybe not the greatest place to wait out the virus.
Out of the frying pan into the fire, but that's not strong enough.
In the beginning, when this whole thing kicked off, I mean, the news here was much more severe, and the U.S. seemed like a safer place.
Mm-hmm. I remember Ryan, February of last year. I remember you talking to me and being like, "Dude, thinking about hopping on a plane right now. The numbers here are crazy," and right. you were halfway to the airport.
Yeah, I mean, it was reasonable. It was like, it's all at the time. News. It's burning up here. It's this new thing. Look at Wuhan. It was just like, yeah. I mean, I've got a place to be. So, yeah. But going to my point, I was wanting to say like how we've been coping with it. So for me, the way I got out of my funk was, well, one, I'm living with someone who called me out on it. It's like, you're kind of a boring person right now. That helps.
For sure.
But I just started getting a lot more. I tried making a lot of like my hobbies a little more aggressive, and nothing really stuck. So I play a little music. So I tried writing some new songs and stuff. It just didn't really stick. I needed something that was really purpose driven, really like, and it had to be something with a schedule, with a pattern. And that's where, like, I've always been a runner for years and years, but I've run more in the last 12 months than any 12-month period of my entire life. And I've been just, I think having like statistics, like collecting the data and just having like those goals, it was a thing. It's nothing. It's just running. It's probably the most like banal, like, unless you're talking to another runner, there's not much of a conversation to give here. I'm not racing. I'm not training to get better.
There's no heart attack at the end of yours though, like mine, so yeah.
It's just, my goal was just go out. But because I had that, it got me into this pattern where I started, I don't know, maybe it's just also just doing cardio makes you feel good, right? But I had to have something. It just was it was a simple goal, and it flipped the switch for me. And suddenly I started seeing the opportunities that I have with all this free time, and how this is a blessing, and how I need to take advantage of it and be grateful. But it really started with, I don't think it's that it's exercise. It was having a pattern where it's like every week you're doing this thing, right? You got to keep it going.
Well, think about this. This kind of messes with my head, and I know we're going a little bit long, but think of like when you're teaching, how much you're moving your body. It is, I'm standing, and think of now, all of a sudden you're just plopped down on the sofa for that whole 8 hours where you would have been walking around. I mean, I think you've just transferred some energy from one space to another, and you found an outlet for that. I dabbled with the gym and exercise, but I'm so, it's kind of off and on for me. What I did do was I bought a little travel guitar. Have you ever seen these before? They're like, it's an inverted, the sound hole becomes the neck, and it's backwards, and it's a little electric guitar that runs on a 9-volt battery. And so I put headphones on, and I just noodle the pentatonic scale in the living room while my wife and my daughter are watching TV or watching a movie, and I just practice the scales over and over again. And it was just, it's like an outlet. It's therapy. And you have to do something.
You gotta have something.
Yeah. Gotta have the thing. All right. Well, I think that's a good place to end. Oh, sorry, Kev, did you I skipped over you. I'm sorry, man.
Oh no, you guys have done of positive things. I've mostly just gone crazy. I'm slowly losing my mind.
Well, here's the $1 million question. We could leave it at this. Do you think we're going to be online next semester, or do you think they're going to pull this thing together, pull off the miracle? What's your every time we talk about this, like every week my answer changes. Had you asked me this 2 weeks ago, I would have said like maybe 100% we're in the classroom is what I would have said.
I wouldn't have said 100, but I would have said it's pretty good odds. As of today, it's no, it's not looking very looking very likely. But who knows? Maybe 2 weeks from now, my opinion will be changed yet again because something else is going to change. As of right now, I would be surprised if we go in the classroom. They're probably gonna pull the plug pretty quick here, but we'll see. That's my
last week, based on the stats and seeing the downtrend for the last 10 days, I was like, it's coming together. Yeah, they're getting the vaccine rolled out. It'll be all right. And then like yesterday, Kev hits me up on a text message or whatever. It's like, there's like over 1,000. I'm like, what? Okay.
Well, this
flip the story.
How funny is this? Like this COVID episode is totally different than the one that we just had, 2 weeks ago. It's just so bizarrely, I mean, we talked about the same topic, but it's essentially things have just shifted so seismically, so quickly, and so you can never count it out that we'll not be in the classroom, but it's just not looking good, and that's why that's why we need those kind of external coping mechanisms, like that, like running and
like the podcast, talking to you guys.
This is one of the things, man. Yeah.
Yeah, this is our jam every week. It's awesome.
There it is. Well, I'll tell you what. Let's leave her there, and I'll just do the outro here quickly. Don't forget to hit subscribe on the YouTube channel. We need more subs. If you like the video, hit the like button. That helps with the algorithms. I don't know. I just made that up. But if you're listening to the podcast, it's the thing, right? You can find us on all the major platforms. We're on iTunes, Stitcher, Amazon Music, Pandora, TuneIn. And if you really want to help us out, this is something that really does help, is leave a review in Apple Podcasts. Give us a good review in Apple Podcasts, and that will really move us up the list and get more eyes on our podcast. And the deal remains the same. Send us an email at thesoulpatch@gmail.com and spell soul SEOUL. And whoever writes that email, I will read it at the beginning of the podcast. I promise you, no matter what you say, I don't care. The good, the bad, the ugly. It's a terrible promise.
It's a terrible promise, but I'm so excited.
I know. Actually, I kind of hope it's terrible. That'd be more fun, right? If someone just tries to rip us a new one. Yeah. And if you have anything to add to the discussion, or there's some topic that you guys want us to talk about, send us an email, thesoulpatch@gmail.com. Take care, everybody. We'll catch you next week here at the Patch. Good night.
Later. Bye.
I'd like to pay a couple respects to the people that made me what I am today.
Laughing gear.
It's all my love. It's all my love.
The quiet man.
It's all my love. It's all my love.
Dopamine. Jim.
It's all my love. It's all my love. It's all my love.
The brain.
It's all my love. It's all my love.
Hey, Bobby.
Let the bass go.